1. When training CET candidates, which adult learning strategy best supports long-term retention of EKG interpretation skills? A. Engaging learners in repeated practice with real patient tracings. B. Providing theoretical lectures without clinical examples. C. Encouraging memorization of terminology alone. D. Limiting exposure to abnormal rhythms. 2. In a CET certification course, what is the main purpose of formative assessment? A. To monitor learning progress and provide timely feedback. B. To determine the final course grade. C. To measure instructor performance only. D. To rank learners by speed of completion. 3. A CT educator wants to evaluate practical competence. Which assessment type is most appropriate? A. Performance-based simulation using EKG machines. B. Multiple choice written test only. C. Peer evaluation without supervision. D. Unstructured oral questioning. 4. What principle of adult learning is most relevant when designing CET lab sessions? A. Adults learn best through hands-on, self-directed experiences. B. Adults prefer passive lecture-based instruction. C. Adults avoid collaboration. D. Adults require strict memorization methods. 5. During clinical mentoring, a CET instructor notices a student misplacing electrodes. What is the most effective teaching response? A. Demonstrate proper placement, then allow the student to practice immediately. B. Publicly correct the student in front of others. C. Provide no feedback to encourage independence. D. Repeat theory without demonstration. 6. Which communication skill is essential when explaining EKG procedures to patients? A. Using clear, empathetic, and jargon-free explanations. B. Speaking quickly to save time. C. Using complex medical terminology. D. Avoiding patient questions to maintain control. 7. In a CT curriculum, backward design ensures A. Learning activities align directly with certification outcomes. B. Content is chosen randomly based on instructor preference. C. Assessment is created before objectives. D. Learning outcomes are developed after course completion. 8. Which type of evaluation determines whether CET trainees can apply knowledge in real-world practice? A. Summative performance assessment. Diagnostic pretest. C. Self-assessment only. D. Attendance tracking. 9. When teaching EKG lead placement, what strategy best supports kinesthetic learners? A. Using real equipment for hands-on practice. B. Providing only visual charts. C. Reading textbook passages aloud. D. Requiring written essays on technique. 10. In CET education, what is the primary role of feedback? A. To improve learner performance through constructive guidance. B. To highlight failure and impose penalties. C. To replace instruction. D. To assess instructor credibility. 11. How can a CET mentor best model professional communication in a clinical environment? A. Demonstrate calm, respectful interaction with patients and colleagues. B. Use medical jargon to display expertise. C. Minimize dialogue with patients. D. Avoid involving learners in conversations. 12. When evaluating learning outcomes in CET programs, which metric indicates true mastery? A. Accurate EKG interpretation during simulations. B. High course attendance. C. Memorization of textbook definitions. D. Written recall of procedures. 13. Which teaching approach aligns with competency-based CET education? A. Allowing learners to progress after demonstrating proficiency. B. Requiring all learners to finish at the same time. C. Grading based on participation only. D. Limiting evaluation to theory tests. 14. In CET instruction, what is the purpose of a needs assessment before training begins? A. To identify learners' prior knowledge and experience levels. B. To standardize all instruction regardless of learner background. C. To delay curriculum planning. D. To evaluate instructor bias. 15. A CET educator integrates ethical scenarios into lessons. What is the key benefit? A. It develops critical thinking and professional decision making. B. It reduces student workload. C. It replaces technical skill training. D. It promotes rote memorization. 16. When supervising trainees, how should a CET mentor provide corrective feedback? A. Immediately, privately, and with actionable guidance. B. Delayed, general, and nonspecific. C. Publicly and emotionally charged. D. Ignored until the end of training. 17. Which learning objective best demonstrates higher-order thinking for CE candidates? A. Analyze and interpret arrhythmias to identify cardiac conditions. List EKG electrode colors. C. Recall basic heart anatomy. D. Name common lead configurations. 18. In an adult education environment, CET instructors should A. Respect learners' existing professional experience and build upon it. B. Assume all learners start from the same knowledge level. C. Avoid collaboration to prevent confusion. D. Limit participation to ensure uniform results. 19. How should CET educators address diverse learning preferences? A. Combine auditory, visual, and kinesthetic teaching methods. B. Use only written materials. C. Assign identical tasks regardless of learning style. D. Avoid demonstrations. 20. What regulatory compliance standard is most relevant for CET practitioners? A. HIPAA for patient data privacy. B. OSHA for marketing. C. ADA for billing procedures. D. IRS for tax documentation. 21. In evaluating CET trainee performance, validity ensures A. The assessment measures what it intends to measure. B. The test is long enough to appear rigorous. C. Scores remain consistent over time. D. The exam content is overly broad. 22. A CET trainer wants to develop a mentorship program. Which element ensures sustainability? A. Structured feedback loops between mentor and trainee. B. Informal check-ins without documentation. C. Unsupervised learning. D. Random scheduling. 23. What role does formative evaluation play in CET programs? A. It identifies learning gaps and informs instructional adjustments. B. It certifies final competence. C. It serves as an audit. D. It measures attendance. 24. Which instructional approach best encourages reflective learning among CET trainees? A. Post-lab debriefing sessions to discuss challenges and lessons learned. B. Memorizing EKG terminology lists. C. Performing repetitive drills without discussion. D. Reading technical manuals independently. 25. What is the most effective way to teach professionalism to CET students? A. Modeling ethical behavior and setting clear expectations. B. Assuming students already understand ethics. C. Using disciplinary measures only. D. Ignoring minor professionalism issues. 26. When evaluating EKG accuracy, which learning method develops problem-solving skills? A. Reviewing case studies with abnormal tracings for group analysis. Memorizing normal EKG patterns only. C. Avoiding discussion of complex cases. D. Relying solely on instructor explanations. 27. In CET courses, simulation-based learning improves A. Critical thinking and real-world performance readiness. B. Memorization and theory recall only. C. Test-taking speed. D. Instructor evaluation scores. 28. To maintain regulatory compliance, CET educators must A. Ensure all patient information used in training is de-identified. B. Share confidential data for discussion. C. Store personal data indefinitely. D. Allow unrestricted access to training records. 29. What is the advantage of peer mentoring among CET trainees? A. It builds collaboration and reinforces learning through teaching. B. It replaces formal instruction. C. It creates competition rather than cooperation. D. It distracts from assessments. 30. When developing CET course materials, how can instructors ensure alignment with certification standards? A. Map objectives directly to NCCHA CET exam content domains. B. Use unrelated healthcare material. C. Focus only on general science topics. D. Exclude testing competencies. 31. What is the best way for CET mentors to evaluate professionalism in trainees? A. Observation during patient interactions and clinical teamwork. B. Review of written exams. C. Automated test scores. D. Peer survey alone. 32. Which communication technique builds trust with patients before EKG testing? A. Explaining procedures calmly and allowing questions. B. Using humor to minimize seriousness. C. Avoiding conversation. D. Speaking in technical jargon. 33. A CET instructor designs a final exam requiring interpretation of live EKG readings. What type of assessment is this? A. Authentic, performance-based assessment. Diagnostic pretest. C. Paper-based recall test. D. Self-evaluation only. 34. When mentoring a new certified EKG technician, which instructional approach best helps them interpret complex arrhythmias accurately? A. Using real patient EKG strips during guided analysis sessions. B. Focusing only on textbook examples of normal rhythms. C. Allowing trainees to interpret without supervision or feedback. D. Avoiding discussion of abnormal findings to prevent confusion.